Hello and good evening, everyone. Welcome back to another stream here on our American Family Insurance DreamBank page. I'm Maddie. I'm a Dream Curator here at DreamBank. Tonight I have the honor of introducing Dr. Nathaniel Chin. Dr. Chin is a board-certified internist and geriatric attrition. Sorry, I butchered that. And assistant professor of geriatric medicine at the University of Wisconsin School of Medicine and Public Health. In addition to doing memory evaluation in the clinic, Dr. Chin is a medical director of the Alzheimer's Disease Research Center and the Wisconsin Registry of Alzheimer's Prevention Study. Dr. Chin's father was diagnosed with Alzheimer's disease and dementia, and his experience has greatly influenced not only the care he provides to his patients or the research he does, but also how he chooses to live his own life. Take it away, Dr. Chin.
Well, thank you for having me on this live show, and it's great to be a part of this program. It's really important to be able to get this information out, and I'm very excited to be talking to everyone about building your brain buffer, as we like to call it, at the Alzheimer's Disease Research Center. And what I'm going to explain to everyone or share with everyone is really research that is driven by our center as well as our colleagues across the country. And so I have a few learning objectives, really to define what is the brain buffer in the context of getting older, introducing some brain health pillars, which are lifestyle interventions that we study at our research center, highlighting some of the evidence that supports what I'm going to say, and then ending by introducing habit change. And so I like to start with this figure, where you see on the horizontal axis, there's age. And if you can see my mouse move, that's age. And then on this vertical axis is cognitive function or your thinking ability. And this is a figure that shows aging over time. And so what we see here at this line is that as we get older, unfortunately, our cognitive ability goes down slightly. It is not a straight line. And what I mean by that is that the studies that we have done, lifespan studies, have really shown that our cognition, our thinking ability, starts to change and decline around the age of 30. Now, that's not good news, but these changes are very subtle and very minor in the beginning. There is this inflection point, meaning from 30 to 60, it's really dependent on the individual, the life that that person is living, the genetics that that person has. But around the age of 60 to 65, we see most people will have some form of change. They'll notice some level of difference between their 50s and their later 60s. This makes sense because at the age of 50, we do lose about 1% of our muscle mass each year. So we do know that there's going to be some loss as we get older. Now, the most likely things to decline when it comes to our thinking ability are what we call episodic memory, or that very short-term memory, our working memory. Keeping things in mind is the phrase that is often used, as well as processing speed. It just our ability to process information tends to go down. Now, the least likely things to decline are our speech, our ability to communicate, language processing, and then that procedural memory. That's thinking of muscle memory, for instance, but our ability to do the things that we do routinely, we tend to keep those. And then some things increase over time, like our fund of knowledge, our vocabulary knowledge. Also, we have to remember that the definition of normal also changes as we get older. And so, for instance, if we were to give you a word test where we ask you to remember 15 words, and we give you trials to remember it, well, at the age of 70, 8 out of 15 would be considered roughly expected or normal. But if you were a 30-year-old and you scored 8 out of 15, that would be more concerning and considered borderline. So other ways of looking at just normal aging, there's a slower rate of learning. So we're just simply less efficient and we need more repetition, but we can still learn. So that's the key difference there. Our slower processing and our reaction times are slower. We have an increased difficulty with free recall. And this is one of the most frustrating things for people as they get older. This is in the middle of a conversation, having a difficulty finding that word that you want to use or finding that fact that you want to refer to. And it's harder to do as we get older. You can still do it. And oftentimes after the conversation, that word or fact might come to you. But in general, we need more context. We need more cueing. There's also an increased difficulty with words and name finding, and then less cognitive flexibility. So that's just meaning we're more distractible than we have been in the past. It just takes more for us to focus, but we can still focus. And a lot of these changes that I'm describing deal with structural changes of the brain. And so we know that there's brain atrophy or brain shrinkage. And so what I have here in this figure, this picture right here, are two healthy brains. It may not look that way when you compare them, but this is a healthy 30-year-old, for instance, and this is a healthy 70-year-old. And that just means that you can see over time, as we get older, our brains do shrink. We do have brain cells that die, and we aren't able to regenerate the replacements. There's also a loss of connections between brains. So here's a picture of a brain cell, but imagine this brain cell in the bottom figure, if you can't see my mouse, that has to communicate with another brain cell. And that area of connection is called the synapse. And we can grow more of these synapses, even if we're not growing more brain cells. But as we get older, we're losing more of these synapses. And so some of the density of our brain goes down because of that. And some of the age-appropriate brain cell death that happens can be due to blood vessel changes. So we have an increase in small blood vessel disease, simply meaning that the blood vessels go from bigger to smaller. They're more narrow than they have been in the past. And this figure here just simply shows some of the connections between the brain cells, whereas this figure shows how important blood vessels are in providing nutrients to our cells in the brain. So Alzheimer's disease is really an abnormal deviation from that aging. It is not a normal process. And so what I have here is that same figure from before, age on this horizontal axis and thinking ability on this vertical axis. And you see that, all right, so here's us getting older and there's some decline. But in Alzheimer's disease, over a period of time, we are accumulating Alzheimer's disease brain changes. And that in particular are two abnormal proteins that we call amyloid and tau. And those brain changes are happening for a long time. We have learned that it takes decades of that accumulation before things tend to change for us. And that change is this red line. So you can see here that there is a deviation from normal aging in Alzheimer's disease. And at some point along this red line of disease, you will see a provider, a healthcare provider, and you'll receive a diagnosis of what we call mild cognitive impairment. And because it's Alzheimer's disease, it means it's progressive and we don't have a cure right now. And so things are going to get worse, and eventually you will have a diagnosis of dementia due to Alzheimer's disease. And those brain changes, again, that I'm referring to are neurofibrillary tangles, which happen inside the brain cell, and then amyloid plaques, which happen outside. And they happen in a particular order, with plaques first, followed by the tangles. And so we can detect those changes, that pathology, without needing an autopsy. And that's quite significant, because in the past, we actually had to have people die in order to go into their brain and look at it to see the changes of Alzheimer's disease. So our pathologists were critical in doing this. And of course, that's not helpful to the living and to those who want to identify change earlier. And so now with advanced technology, whether it's a lumbar puncture or a PET scan, we can identify those proteins in healthy people, in fact. And so this is a figure of 3 different scans in a 70-year-old woman who's a research participant at our center. She doesn't have any symptoms. And we have the 3 scans. So this is a brain MRI that's looking at the structure. This is an amyloid PET scan, and that red indicates the presence of that amyloid protein. And then these are tau tangles. So this is another PET scan with tau, where we're actually identifying the tau protein. So this person in the research world has Alzheimer's disease, although did not have any symptoms. But we can now identify those changes. And that's been a really critical thing as far as research and understanding the disease, but then coming up with treatments and hopefully a cure. But we also know that people can have Alzheimer's disease pathology or changes, but not actually have any symptoms. And this is a really reassuring and good thing. And this has been going on for years. So one of the earliest studies came in 2000 and others in 2006 and 2009, where what they did was people did pass away and they donated their brains to science. And we were able to look at those brains and see those changes of Alzheimer's disease, but there was no clinical report of it. The person was not experiencing any symptoms. And so time and time again, these studies showed that you can have the changes without actually having the symptoms. And of course, it's the symptoms that we fear the most in Alzheimer's disease. And this has been repeated multiple times, but a really important study that happened in Chicago and Minnesota and even here in Wisconsin was the nun study. And in the nun study, these nuns donated their time, their energy, and then eventually their bodies to science. And the scientists got to look at their brains. They found some that had Alzheimer's disease and others that did not. And then they looked at their report of were they physically active, what kinds of things were they doing. And they were able to say that there are certain people that have changes of Alzheimer's but didn't have symptoms, and they tended to correlate with people who were physically active or who were cognitively active. So it was a really revolutionary study that really prompted a lot of research to look at, well, what is it about these particular individuals? And it really speaks to this cognitive buffer. And so this figure here really is trying to represent the prior figure. So you have age on this horizontal axis and cognitive ability on the vertical axis. And let's start with this red line. So this is just a regular person who over time, as they are going through life, they eventually start to decline in their function. And then they cross this threshold, and this dotted line represents sort of a clinical threshold. Well, now they're diagnosed with having dementia, and it's due to Alzheimer's disease. And so they continue to decline. And for reference sake, we're going to say this person has a low buffer or low resilience. Now, the blue line represents the same person, but who happened to have lived a different type of lifestyle or had different types of education or cognitive engagement, thinking engagement. And so this represents a higher resilience. And then in that same individual, you can see that actually their decline is slower. And that slower decline means that they cross that threshold at a later time, at an older age. So they're diagnosed with dementia years later than they would have if they had low resilience. This is a really important concept. So one way of thinking about it is the more resilient you are, the more cognitive buffer you are. That means the more springs you have in your body. And so you can actually withstand the weight, or the bed frame can withstand the weight of the individual. For those that are more interested in military history or Renaissance, another way of thinking about it is the strength of the wall of a castle. So the stronger that wall, the better your cognitive buffer, the more you can withstand the changes that happen as you get older. And so think about cognitive buffer as resilience. And I have the figure up here just as a reference sake. But I think it's such an important concept that I want to try a different analogy with everyone. And so think about getting older as a rain cloud and raining. Well, our goal, of course, is to stay dry when it's raining. Well, at least for this argument, let's say we're trying to stay dry. Just like we're trying not to have memory loss as we get older. Well, we can't stop the rain, and we can't stop getting older. And as of now, we can't stop the Alzheimer's disease changes in our brain. But we have the ability to engage in a cognitive resilience. And so what does that look like? Well, that's having an umbrella. So in this example here, we can't stop the rain from coming, but we can have an umbrella and that can withstand the rain. And that's a really great initial buffer. But so much like rain and aging and getting older, things are much more complicated than that. And so it doesn't necessarily mean that the rain is coming straight down. Maybe the rain is coming from the side. Maybe getting older isn't just about a person's blood pressure, but it's about their weight, and it's about their activity levels. And so there's other variables that we have to account for. And so what other modes of resilience do people have? Well, in this example, I'm using a raincoat. So even though you have your umbrella and you're handling the rain from on top, the raincoat's going to protect you perhaps from the rain that comes from the side. That's what I mean by a buffer. So it's the multiple buffers. It's the ability to withstand things that you may not be able to control. And so with that in mind, there are a couple of key mechanisms of cognitive buffers or cognitive reserves. And so one of them is epigenetics. So often and for so long, we thought that our blood is our destiny. Whatever our genes tell us we're going to be those. And as our scientists are exploring this, the more we're learning, the more we recognize that that really isn't the case. Yes, genes are very important, and they do drive a lot of our life. But we know that with epigenetics, it isn't just about the genes. And so this figure here is very complicated, and I'm not the right person to explain it in detail, but what I can tell you is that we realize it's not just the genes right here that I'm circling this chromosome. It's how those genes are organized. It's how they're processed, and this this little protein that kind of presents the genes to the rest of the body, that has an impact on how those genes are either activated or deactivated. And beyond that, there are other mechanisms, there are other ways that our genes are modified, again activated, or transcribed into proteins that end up doing things. All of that is up for modification to some degree. And so epigenetics really shows that lifestyle interacts with our genes, which means that a certain type of lifestyle may provide more of a buffer, which means that it can modify some of those genetic risks. The other thing I wanted to talk about was neurogenesis. So neurogenesis is the growth of new brain cells. It's the idea that there are stem cells or original cells in our brains that can sprout off into different types of brain cells and therefore grow and increase those numbers. And so this figure really just shows that there are ways of our brains reproducing or producing more of the cells. Again, we used to think, oh, whatever cells you have by the age of 20, those are going to be the cells that you have. And that's simply not the case. Certain things can stimulate more brain cell growth. Certain lifestyles can actually stimulate more of the synapses, those connections between cells. So it's not a fixed thing. And so cognitive buffer reserve means that we have some control over how our brains are developing, even as we're getting older, how they're being maintained. And maintain is a key word here. So cognitive buffer can also mean brain health. And so when I mean brain health, I'm thinking of maintenance, taking care of the things that we already have. And so I have this figure of these individuals with their maintenance gear, their tools. And what do? Well, they tune things up, right? They poke and they prod and they prune and they fix the things that we already have in our bodies. And so I like this figure here in the middle because it kind of reminds me of those brain cells and the synapses. So the figure here now next to it, each of these is a brain cell, and these little connections that they connect to, those are synapses. That is where everything happens. That is where our brain cells communicate. That's how we pay attention. That's how we learn to speak. That is how we function day to day. And so if we can maintain or tune up our health, our body health, our brain health, we're creating a buffer. And so for me, that means managing chronic conditions. So as a geriatrician, even though I'm focused very much on the brain, I care very deeply about the rest of the body and how we're maintaining it. How are we having optimal health? And so this is just a word diagram of what does chronic disease mean, but they hit some of the key chronic conditions that I care about when it comes to the brain health. So high blood pressure, hypertension, stroke, vascular disease, cholesterol, obesity, diabetes, heart attacks, arthritis, neuropathy, sleep apnea. These happen to be some of the same risk factors for other conditions like COVID-19, but also for our brain health. And another way of thinking about this is that chronic diseases do require treatments. And while this picture here shows what's likely going to be a syringe for insulin and then pills, it isn't always about medications. How we live can also help manage our chronic conditions. So what are these risk factors for dementia? So this isn't specific to Alzheimer's disease, but just dementia in general. And a study that was done in 2014 really looked at what have all the other prior studies done, putting them together, what is a person's risk of developing dementia if they have that particular condition. And so what I've put together for us here is some of the 9 key ones. And so you see here in the upper left, depression. So depression has a risk of, just pay attention to the point number, so 0.85, 85% increased risk of dementia if you have depression. Midlife hypertension, 61%, obesity, 60%, smoking, roughly 60%, cholesterol, we have diabetes, roughly about 50%, physical inactivity, so not even related to obesity or blood pressure, just being inactive, 39%, kidney dysfunction, 39%. And then what's not listed here as number 10 is heart disease, and that itself was 36%. So these are all modifiable, meaning right now we can't stop the progression of dementia if you already have it, but these modifiable conditions we do have control over, and arguably if we manage these, we might modify the course of dementia and improve our brain buffer. The other thing to keep in mind is that the more we are studying, the more we're looking at brains during their autopsies, the more we realize it's not just one pure disease. So it isn't just Alzheimer's disease for an individual, or it isn't just a stroke, or it isn't just Parkinson's disease. And so this study was done at Rush University in Chicago, and they looked at just over 1,000 people who donated their brains to science. And what they found, I just want us to focus on the far right figure here, but of those who had suspected Alzheimer's disease or dementia due to Alzheimer's disease, they found that really in a large percentage of them, it was Alzheimer's plus another disease plus vascular disease. And in another good percentage of people, it was Alzheimer's and vascular. So almost, and we see here, vascular disease was present in about 90% of cases, meaning that we missed this condition because we thought it was just a pure disease, one other pure disease. And what I think this really speaks to is even if a person has dementia due to Alzheimer's or dementia due to Parkinson's, there are things that we can do for our whole rest of our body, addressing our vascular health in particular, that will help us, because it's likely that vascular disease is present and contributing to a person's symptoms. And so what are these modifiable risk factors? This is a figure from The Lancet, which is a popular and very respected journal, looking from 2017. And this first one talks about increasing your brain reserve or your resilience. And they talk about cognitive stimulation, education, really preserving your hearing, your vision, social engagement, reducing some of those risk factors like depression and exercise. You'll see that exercise overlaps with all three of the main mechanisms. This next big circle is talking about reducing brain damage, reduce those catapults that are hitting your castle. And that's stop smoking, reduce your obesity, exercise, follow a healthy diet, and treat those chronic conditions that are harmful to your brain. And then lastly, inflammation seems to be a very strong driving force when it comes to brain disease. And so whatever we can do to reduce inflammation. We don't actually recommend non-steroidal anti-inflammatories because there are side effects and the evidence isn't strong that that reduces inflammation in the brain, but exercise and a healthy diet do have evidence. This isn't just done in The Lancet. The World Health Organization recently came out with a very similar list of things that we can do to reduce cognitive decline or dementia. And you'll see there's great overlap. Physical activity, stop smoking, healthy diets, limit your alcohol, cognitive engagement, social engagement, and then management of all of those chronic conditions. So our brain health pillars that we talk about at the Alzheimer's Disease Research Center and the Wisconsin Registry for Alzheimer's Prevention really are grounded in those principles. So the 6 pillars that we speak of are physical activity, the food that we eat, how we are sleeping, cognitive activity, social activity, and stress-reducing activity. And I intentionally use the word activity because it's a lot. This is asking a lot of people, but it is beneficial not just for your brain, but for the rest of your body and your overall wellness. And so some general tips that are based in science that we recommend are for physical activity, roughly 150 minutes per week of aerobic activity. That comes from the CDC. They actually recommended 150 to 300 minutes. As far as food goes, there's a lot of different opinions, a lot of different evidence out there. So depending on what you're reading, they might argue one way or the other. But most people would agree that the Mediterranean diet is a very healthy diet. The MINDS diet, which is Mediterranean and low salt, and a little bit of more anti-inflammatory, antioxidant foods like blueberries and raspberries, that tends to be very popular in those with family histories of Alzheimer's disease or very focused on cognition. When it comes to sleep, it isn't just the number of hours that you sleep. It's actually getting restorative, good quality sleep. And so we are looking for 7 to 9 hours, but we want them to be high quality hours. For cognitive engagement, trying to do something daily, I think, is really important because it's a part of our routine. But the 2 main ingredients to that are 1, it's enjoyable because then it's going to be sustainable, and 2, that it's challenging because you need to push your brain in order to build more of those synapses, more of those connections with brain cells. As far as social engagement, that's really hard right now, but spending time with the people that you care about. When I'll have a couple other tips later on, but while this is difficult, it still can be done during a pandemic. Stress-reducing activities, something that helps you unwind, something that helps you relax. So some of the evidence that supports physical activity comes from our own researcher at UW, so Dr. Oziomo Okonkwo and his team. And so he's very much focused on cardiorespiratory fitness. And in his study from 2014, in this left figure, you see that on this horizontal axis is fitness. So you're more fit as you go left to right. And then on the vertical axis is brain size, but particularly the memory center called the hippocampus. And so you see the more fit you are, you tended to have a bigger brain. This is not cause and effect. This was just observation observing this, but it is a consistent finding among many different studies. The same concept here. So the more fit you are, you're going left to right. But this vertical one is amyloid burden. So amyloid is that protein in Alzheimer's disease. So the higher up you are, the more amyloid you have. So you see that the more physically fit you are, the less amyloid you tended to have. So that's an important observation. That was not one causing the other, but it was a really important study in 2014. And it led to a study that was being done by Dr. Okonkwo and Max Gatan that was just published last year, where they now did an intervention study. So this was a true clinical study where they split participants. Some of them stayed in what we would consider the control group, which is just usual activity. That's the bottom figure here. And then others are the intervention. So that's the aerobic exercise group. And in those individuals, they did exercise with a trainer 3 days a week, and they had to gradually increase the duration and intensity. Initially 20 to 35 minutes, then 40 to 50 minutes, and then 50 minutes a day. And then this heart rate, maximum heart rate, they had to increase the intensity over time as well. And so they were looking, in this study, they were looking at late middle-aged participants at risk for Alzheimer's disease over 6 months. And they had 3 specific outcomes, which I'll show you in the next slide. So this shows you some of the outcomes. So when they were looking at cardiorespiratory fitness as a measure of in those in the control group and those in the physical activity group. And this pretty much shows you that those that were physically active have better fitness. This kind of makes sense, right? So this picture here is meant to simplify things. If you're going to be physically active, if you're going to be exercising, you're going to improve your cardiorespiratory fitness. You're going to improve your heart, your lungs, the blood vessels that connect them. So the next figure on the right here, this is dealing with the cognitive testing that the group looked at. And so this is a really complicated figure. And so I'd rather just say to you, the more physical activity you had, the more cardiorespiratory fitness you had, the better you did on testing. And in particular, those memory tests, and then what we call executive function, which is our ability to multitask, to process information, to reason and problem solve. And so exercise led to those improvements. Now, lastly, and I'm going to keep the original figure or pictures here. Lastly, exercise led to just healthier brains. And so there's a special PET scan, so another fancy imaging technique that looks at glucose use. And the more glucose use in your brain, it reflects a healthier brain. It means the brain cells are churning through glucose. They're productive, they're active, they're doing what they're supposed to. And so we can measure that degree of glucose use through this type of glucose PET scan. And our usual activity group, this is a healthy brain. You'll see the red represents increased glucose use, followed by yellow and then green. But look at the exercise group on the bottom part of the figure. So there's more red, there's more glucose use throughout more parts of the brain, indicating those brain cells are healthier. And there's just more yellow and red for the rest of the brain. And so this reflects just overall healthier brains. This figure on the right shows the more physically fit you are, the better or the more glucose use that was used. And so again, exercise leading to healthier brains. And it isn't just healthier brains, but exercise has been shown to improve depressive symptom, anxiety, stress, reduce your blood pressure. It helps with weight management as well as appetite control, and it can help with your sleep. The nice thing is all of these bullets also are factors for developing cognitive change, developing dementia. So exercise isn't just about the brain itself, it also addresses other risk factors for the brain, for brain changes. Now the MIND diet that I mentioned before, which is Mediterranean Dash Intervention for Neurodegenerative Delay. That is a mouthful, which is why we say MIND. It is associated through studies with reduced development of Alzheimer's disease. These are important studies that were done by Martha Claire Morris and her team at Rush in Chicago. They used food frequency questionnaires, but then also did cognitive testing and brain imaging. And they broke people down into 3 groups. The people in the lowest group just followed the diet somewhat, and then the middle group followed it more, and then the third group followed it the most. And so those that followed it in the second group, so the middle group, they had a 35% risk reduction in developing Alzheimer's disease. If you followed it the most, pretty strict in that regard, 53% risk reduction in Alzheimer's disease. That's very similar to the Mediterranean diet alone, which is about 54%. The Mediterranean diet alone is not the easiest diet to follow, and so the MIND diet offers a little bit more leniency to people. For instance, the MIND diet is more okay with cheese than the Mediterranean diet would be. When they did statistics in comparing brain sizes and brain health, they found that following the MIND diet the most compared to the least meant that your brain was younger by 7 years. And while that's just a statistical expression, it's still a very valuable way of saying this diet has a true impact on your brain's health. And this is just a picture of what it could look like. In general, we think of berries as antioxidant, healthy fats like avocado and olive oil and mixed nuts, and then vegetables, fruit, salmon, and lean meats. But you do see a picture, I believe, of a dessert, so it doesn't exclude desserts. Other health benefits: reduces inflammation, reduces heart disease rates, diabetes, helps with weight loss, and then there is a study that shows it's associated with a longer lifespan. So sleep is another really important factor in our brain health. And we at the Wisconsin Registry for Alzheimer's Prevention did a study looking specifically at sleep. And so participants filled out questionnaires related to sleep, and there were 101 people that filled out these questionnaires that did not have impairment. Specific things I'll go over in a second. But then also we were able to obtain cerebrospinal fluid from these individuals. So we could look for those proteins of Alzheimer's disease. And those proteins, again, this honeycomb thing, that's amyloid, and then the blue, that's the tau protein. So that's what we were looking for in these individuals. And what we found was that subjective report, meaning that the participant report of poor sleep, is actually associated with those brain changes of amyloid and tau. And the three things in particular were those who reported less adequate sleep, more sleep problems, and increased daytime sleepiness. Now, this does not mean that these caused the amyloid and the tau, but that there was some relationship when we observed this. Again, not an intervention study, an observational one, but clearly there's a signal here. So other benefits of sleep would be improvement in mood, reduction in stress, help with blood pressure, heart disease, weight management. It can help with immune function, and by doing that, reducing inflammation. But it can lead to improvements in your learning and your memory. This picture here on the right, I think, is very nice at capturing. People will report sharper concentration, better decision-making, increased energy, improved physical health, just the ability to manage stress. And I think all of us feel these benefits, or rather we feel the downside if we don't get the sleep. It's harder for us to do these things. Now, cognitive engagement is a really important one, keeping your brain active. And so there's a study, again, looking at Catholic nuns and priests from 94 to 2001. 111 of those 801 participants developed dementia. And they compared those groups, and they found that participants who engaged in more frequent cognitively stimulating activities had a third reduction in the risk of developing dementia versus those that did not. Our own center, the Wisconsin Registry for Alzheimer's Prevention, Dr. Janitis in 2013 looked at 762 participants, and those that reported playing more games, fun games, but challenging games like checkers and crosswords and other puzzles, those that did that more frequently tended to have higher scores on their memory tests. And a part of cognitive engagement deals with social engagement. And so again, some observational studies have shown that the more socially engaged you are, the better your cognitive function over time. And so a study in 2001 that looked at 70 to 80-year-olds, about 1,200 of them, they followed them for 7.5 years, so quite a long time. And the people who reported more emotional support had higher cognitive abilities, not only at baseline, but a slower cognitive change over time. And that change was likely just age appropriate. In 2008, 16,000 people who were 16 or over from the Health and Retirement Study, this is a very big study, they looked at marital status, volunteer activities, contact with family and friends. And those that reported the highest amount of social engagement had a reduced rate of memory decline by 50% compared to those that had the least amount of social engagement. So now here's some intervention studies, and this comes from Finland in 2011. They looked at 235 adults who were in adult daycare centers or senior centers. 117 of them received this intervention, which was some sort of social activity, plus discussion groups and peer support, plus therapeutic writing, exercises, and art. So it was a very multi-domain activity. And they compared those 117 to 118. They had just normal community daycare. And what they found was that the cognitive scores, the thinking scores, were improved in that intervention group versus the control group. This carries a lot of weight because it really is a controlled trial. And then stress. And we're all feeling a lot of stress right now, particularly with this pandemic, with the effects of the pandemic and the restrictions that are in place. So stress is not always good for us, right? So in general, it has a purpose. The fight or flight response is meant to protect us. So if you're seeing a lion or you're developing a cold, you want to have that stress to help us. Also for motivation in meeting daily challenges, in achieving our goals. But the duration of that stress matters. And so if it's short with a clear endpoint, it might not be so bad. But like this pandemic, if it's chronic with no set endpoint, it will have a problem. And it doesn't have to be high intensity. It can be low intensity. And it doesn't have to be constant, but even intermittent over that chronic period. So stress causes changes in the body that lead to hormonal changes. So cortisol and adrenaline being a chemical signal. And so the excess cortisol in particular can increase inflammation. It can disrupt our metabolic system. So that's what this middle picture is showing. It also changes the blood vessel walls, makes them harder, leads to increase in blood pressure overall. So there are studies that look at this, and this is an important one from 2018 that shows that circulating cortisol has an effect on not only our cognition, but also our brain structure itself. And so what they found was that higher cortisol levels were associated, not caused by, but were associated to worse memory and visual perception, as well as just shrinkage in the total brain volume. This was more evident in women and did not have any relationship to the genetic risk factors for cognitive or for dementia. Within RAP, we have shown that just stressful life events, so not necessarily the feelings of stress or cortisol levels, but just the number of stressful life events in your from your life has an effect, a relationship with cognitive test performance. And so in this figure, it's pretty easy to see it's downward. So the more stressful life events you have, the worse your performance on certain parts of cognitive testing. And this is important because the stressful life events and the stress burden is not really distributed evenly among our population. And this was shown in a recent publication by our own Dr. Zolsdorf, who showed that stressful life events and racial disparities in cognition existed and were very much related. So even the perception of stress can affect our brain level, our brain function. So regardless of the cortisol hormone or the number of stressful events you have, just the perception of stress has a relationship to our brain's performance. So in this study, which was done in 2014, increasing levels of perceived stress on questionnaires was associated with lower performance on cognitive testing, faster declines over time in cognitive ability, and was present in both Black and white participants. It led to a 30% increased risk of mild cognitive impairment, a phase that happens before dementia. And that finding was supported by another study done in 2016. And so I just want to stop and say the perception of stress. So it shows the power of our feelings, of our thoughts, in affecting our brain's performance as well as our brain size and our risk of developing disease. And so the tie-in to that is a very recent study that was done looking at repetitive negative thinking and Alzheimer's disease. So before I talk about this study, what is repetitive negative thinking? So RNT. It's a measurable cognitive process. It's a behavior of ours that encompasses future, which is worrying, or past thoughts. In the past, which is what a lot of people do, that's ruminating about the things that upset them in the past, or worrying about the things that are going to happen in the future. So it's really describing a thought process that doesn't have to do with time orientation or even content. It doesn't necessarily matter what we ruminate about or worry about. It's the actual process that has a lot of negative toll on our brains. So in the study that was done, and it was published just in 2020, there were 292 people, 55 and older, that were healthy, good physical and cognitive health, but they had at least one parent or two siblings with Alzheimer's disease. And then they compared those to 68 people that were cognitively healthy with subjective memory decline, or at least they were normal range on their cognitive testing. And so then all of these participants completed questionnaires over a 2-year period, and then they wanted to compare the groups. So the participants with the higher reported repetitive negative thinking, and that was obtained via questionnaires, they experienced more cognitive decline over a 4-year period. So they were more likely to have declines in memory, and they were more likely to have amyloid and tau in those PET scans that I showed you earlier. So this really speaks to the power of our thought abilities, and having repetitive negative thinking is not good for our brains. So depression and anxiety are also associated with cognitive decline, and repetitive negative thinking happens in both of those conditions. However, depression and anxiety are not associated with amyloid and tau, which makes us believe that there's something separate and distinct about repetitive negative thinking. So it could be a mechanism for how people at risk for AD or Alzheimer's disease who also have depression or anxiety may actually develop those changes. So then, of course, the question is, how do I begin? Knowing what we do know now, what do I do with this information? And so when it comes to physical activity, a lot of it is trying to avoid being sedentary. We know there's a 39% risk by just being sedentary. So trying to get up more often, walk around more often. I think really assessing where you are in your own fitness is critical. Be realistic with your goals. Pick an activity that you consider that you would want to do, and then go slowly. So start slow, increase slowly. When it comes to diet, really hard thing to do. Limit some of the unhealthy foods, fast foods, restaurant foods, desserts. I'm really against soda and sugary beverages. Find out the timing of when you eat. Try not to eat right before bedtime. Try to eat a mind-like diet or a Mediterranean-like diet if possible. Even small changes are valuable. When it comes to sleep, really avoid some of that blue light that comes from TVs and iPads, iPhones, and computers. Try to stop those things at least an hour before bed. Limit your fluids, including alcohol in the evening. Keep your bedroom cool and dark. Try to wake up around the same time. And a lot of this is behavior-driven. When it comes to cognitive activities, as I said, make it a part of your routine. Choose something that's challenging. Consider a hobby, a new hobby. If you involve other people, keep it social, and then they help you stay accountable. Might be a time to learn a musical instrument, or card games with friends or family that's in your household, reading puzzles, things like that. For social activity, talk to someone. Talk about, maybe not talk about the news, but maybe talk about things happening in your life. Talk about things that matter to you, recent events, I guess, phone. So do it through the phone or virtual. There are virtual support groups for those that feel more comfortable with that. Stress, as we mentioned, don't eat or drink your feelings. Be kind to yourself. Avoid some of that negative rumination. Find something that helps you unwind, and that doesn't mean alcohol. Find something, whether it's going for a walk or petting your dog, journaling. Find something that you could do every evening to help you unwind. So I want to end by talking about, it's a combination of things. And so a study that combined 2 other studies looked at healthy lifestyle behaviors and gave them points. So not smoking was a point, exercising appropriately was a point, light to moderate alcohol use, the mind, diet, and engagement in late life cognitive activities, all of those received a point. And so they were able to tally sort of how healthy a person was. And so they compared the 2 groups, which were those that had those who are healthy and those that ended up being diagnosed with Alzheimer's disease. And then within those groups, they looked as a reference point those that had 0 to 1 of the healthy lifestyle points. And what they found was that having 2 or 3 of those behaviors had a 37% lower risk of Alzheimer's disease. Having 4 to 5 had a 60% reduced risk. So it really just shows the importance of the combination of healthy lifestyle behaviors. So it isn't just one thing, and you don't have to be perfect at one thing, but doing a combination of things can be really beneficial. So I believe this is my end. And it's the do something principle by author Mark Manson. And what he speaks to is sometimes it's really hard for us to act. We may have, it may be because of motivation, it may be because of lack of inspiration, but what we find is that it is cyclical. So sometimes it takes inspiration to get to motivation, to get to action. Sometimes it takes motivation to get to action. But what he argues is that sometimes it just means we have to do it, even if we don't want to, even if we're not motivated or inspired. Sometimes action can actually lead to inspiration and motivation. And I really like that. I feel like I've provided some of the evidence. And for those that are interested, you can go to our website, to my podcast, to learn about more of the evidence. But sometimes it just takes action. Sometimes you just have to try it and see how it goes, knowing that in the end it's going to be better for you. One thing that I would add to this is awareness, because awareness leads to knowledge and understanding. And so hopefully by listening to this, by watching this, doing your own reading, you're improving your awareness and knowledge, and maybe that is what leads to action, or at least inspiration and motivation. But the more we know, the more it is very clear how important it is that we live as healthy of a life as we can at all stages, whether you're 30, 40, 50, 60, or 85. So this is my podcast. It's called Dementia Matters, and I interview researchers, the ones who I mentioned here in this presentation, and we speak about the issues of Alzheimer's disease, the science behind it, but also issues or caregiver strategies for those that have a loved one with it. So I thank you for your time, and I do believe we have an opportunity for some questions that I'd be happy to answer.
Wonderful. Thank you so much. I am looking, so far we don't have any questions right now, but I just want to say thank you again for coming and talking to us. I know I was taking just like a bunch of notes for just little lifestyle changes I can do. And I am going to commit to actually cutting back on my salt intake. I love salt. It is like my favorite thing ever. I don't know, sometimes I'll like even salt my toast. Like it's really terrible. Like I just love salt. So that is like one thing, like once I make that lifestyle change, I'll think about changing some others. But so thank you so much for sharing this. So far, no questions have coming in. I know I was like writing down questions and then you'd answer it in the next slide, and you did a fantastic job of making it. Oh, perfect.